Hello, it's Dr. Scott MacLean, and I'm going to be reviewing the Universal Scotchbond Plus. This is a product I've had in my office for the last few months. I'm going to share what I feel about this product. The Scotchbond Universal Plus is a dental adhesive suitable for all direct and indirect bonding procedures. It is a one-bottle system that can be used for both glass ceramics and metal. So this is really a great product in my mind to have in your office because it can do so much. Lots of information on the internet. There is an intro kit available, and this is what I used before I also switched over all my purchases to this product. So it is an easy to clean product and also easy to use. Now if I look at the products that I've used in the past from 3M, you can see that Good, Better, and Best really describes them well. And the best now, I do believe, is Scotchbond Universal Plus. And this is because the enhanced bonding has gone further. You've got a higher bonding strength, but also some features that are really great for us as diagnosticians. And if you look at this, it's got this radioopaque feature. So when you take an x-ray, you can see where the adhesive is on the x-ray. And this is important because sometimes the adhesive can make it look like you're actually having a problem with the restoration, when in fact it's just the adhesive pooling and being radiolucent. So I do like this single bottle system. It's a well thought out system. You can hear the click. This keeps it all fresh inside of the bottle. And this is critical because some of this stuff can evaporate and cause problems with bonding. And also it's easy to clean, so as this closes, it seals off that one bottle system, and you're not touching the tip and cleaning the tip of that dispenser, and then it's easy for the one hand to open it. And so click, it opens, and there you can get the product out and dispense it in a single drop. And the drops are well suited for what you're going to use. Now, according to evidence-based dentistry, this is an advanced bonding system, and it even bonds really well to glass ceramics, which is one of the kind of challenges for most adhesive systems, and therefore is able to be used with veneers. So this cement can be used with posts, veneers, metals. It's got MDP, it's got silane, it's got all those things that are needed for advanced bonding. So as we give this a trial on the patient, you're going to do a 20-second scrub. It's important not to go short on this. And when I'm doing this, I'm feeling the consistency, the viscosity, how it kind of paints the tooth as I'm doing this. And it feels to me like when you use a good quality paint, it's covering really well. I don't know if you know what I mean by that, but if you have a poor paint, it just doesn't work the same. And as we're going over the dental tubules and over the enamel, we're actually getting this ability to seal with a hybrid layer that's going to, really kind of make this area so it's going to be an anti-cavity kind of effect. So if there was a little bit of caries in there, this seals things off and is kind of a game changer that way. The manufacturer recommends you air dry for 5 seconds or longer until you see no liquid movement and the surface is still shiny. This is to remove the solvents, which is important to providing the optimum bond. The manufacturer provides 2 different delivery systems, one being the unit dose in the lollipop system, and the other being the vial system, which is what I'm using today. And both are very hygienic. You can dispense the whole lollipop. The vial, of course, you can wipe this down, and it's very easy to do so. So I think that both are very effective in providing excellent treatment to the patient. Now we are doing a direct restoration here requiring a light cure, but if you're using a cementation of a crown and you need a bit more adhesive to help you out, the actual cement is going to start the process of setting of the adhesive, so you don't need to light cure it, which is a great way to control the film thickness in that situation. So after the 10-second cure, we know that that area is going to be sealed around the margins in a very thin film, and so you can finish off your restorations and get these done. And so it provides an excellent seal, radial opacity, and an excellent bond. If you look at the bond strengths of both Universal on the left and Universal Plus on the right, you can see that they perform better than almost everything on the market, if not all of them. And if we look at these in comparison to each other, we'll notice something that's interesting. On the left, we have the Universal. On the right, we have Universal Plus. And we look at the bond strengths, we can see that by looking at enamel first, the total etch and rinse, performs extremely high. So on the Universal Plus, it's at 40 megapascals. So it's gone up 10 megapascals, shown right here. If we look at the next self-etch column, we can see that again, the Universal Plus outperforms. You can see in Denton, the self-etch is about the same, so about 26 megapascals. But if we get into the total etch and rinse for the Denton, you can see that this is performing much better with the Universal Plus. So this has made me switch my Universal into Universal Plus when I see this.
So now, based on that data, using evidence-based dentistry, I would take a diamond and roughen up a restoration like this one, and then start coming in with the Universal etching gel. And so you can see this, we can take this and apply it to the preparation in the enamel, especially in Denton. Both areas will improve the bonding. So by using this Universal etch, we can take a restoration like this and move it up to 40 megapascals, which is an incredible bond for this type of area, and something that we really need when we're having a patient that's doing some parafunctional habits, crossing over, and you can see that they're, taking this edge of their tooth off. So this is performing very well. We can see that when we take the Universal Plus, then this restoration is over the top. It's an incredible bonding situation at this point.
So the manufacturer does recommend a 20-second scrub. And this is important because this is prepping the area and actually doing a little bit of an etch itself. It's self-etching. So you're actually getting the best bond by doing this. So don't skip this step. It's kind of important to using the product and making sure that you're following the situation in the labs that they've tested. So you do a 5-second dry. So it's a standard kind of format that they use. And the 5-second dry just enables you to get down to a very thin layer, and it's shown that you get better bonding if you have one thin layer rather than thicker layers with it clumped on. So then take the light cure, do a 10-second light cure, and so sometimes you have to use the light twice. We do have a good light. We're using a deep curing light, and this is important, making sure your light is tested, and so you can have that done. So for Scotchbond Universal Plus, you do a 20-second agitation, so scrubbing the surface, followed by a 5-second air dry, and then do a 10-second cure. So very much like what we used to do with the Universal. The Scotchbond Universal Plus is a BPA derivative-free product, and therefore it also can provide entire workflows in both direct and indirect procedures that are BPA derivative-free, because there are products that are also working with it that are also BPA derivative-free. So all in all, I'm pretty impressed with this product, and I'm giving it a 2 thumbs up, and I've switched to this product now. So I've gone from the Universal to the Universal Plus, and from the features, especially the feature of the incredible bond and also the radial opacity, this is a fantastic product to get using in your office. So 3M does deliver excellent quality, and I would suggest you try the intro pack and check it out. So this is Dr. Scott MacLean, and this has been a review of the Scotchbond Universal Plus.